Good morning everyone. I'm Dr. Nishita Seth, Director of the DNCC Academy and DNCC Clinic. The courses at DNCC Academy of Beauty and Aesthetics are designed to provide students with hands-on experience and an opportunity to perfect their skills within the safe learning environment. Okay, so we have three types of courses for doctors and non-doctors. First course is 3 days intensive cosmetology course for doctors, and it's designed for medical doctors who want to develop their skills and upgrade their knowledge in skin and hair aesthetics and clinical cosmetology. So who all can do this? This can be done by MBBS doctors, BDS doctors, BAMS, BUMS, BHMS. Okay, who will be training? So the trainers will be our practicing dermatologist and a cosmetologist. After training, you can work as an esthetician, clinical cosmetologist in skin clinics, or start your own cosmetic clinic. The courses includes in this particular course will be clinical cosmetology, that is like we will be explaining you about the skin, what is the skin types and all that. The second will be medical trichology, so it is related to your hair and scalp disorders. Third will be advanced skin aesthetics, in which we teach you advanced skin treatments. Then the lasers. So lasers can be used for laser hair reduction, laser tattoo removal, laser skin tightening, all that. Then we will also teach you about the Botox and fillers. But the Botox and fillers will be only done or practiced by MBBS and post-MBBS doctors, or even BDS and MDS also can do it. But BUMS, BHMS, they will be only observing the doctors performing this or the dermatologists performing this, but they will have the knowledge of it, but they cannot do the hands-on practice. Next is anti-aging therapy. So what is anti-aging? So as we age, we also need to control, or we also need to reverse the clock. So when we say anti-aging, which can be thread lift, which can be vampire facelift, which can be PRP facelift, all that comes. Also anti-aging peels, many peels we use for anti-aging. Then we will also do the skin peels. Second course is for certificate course in trichology. The course is this course is the study of hair loss, baldness and various scalp and hair problems and the treatment of it. Eligibility, who can do it? So this eligibility will be for the doctors, for paramedical staff, basically nurses, OT assistant, beautician, and it can be also done by 10th and 12th pass candidates also. So what is it contained? What we will teach you in that. So training will be on hair and scalp anatomy again, hair and scalp anatomy in a basic level. Like what is the hair made up of, what is the scalp problems we deal with every day. Then the second will be hair analysis with trichoscope. So we have a trichoscope which can analyze the density of the hair follicle and the hair shaft problems or dandruff and all. Third is investigation and treatment of hair and scalp. So what are the investigations we will be doing in the hair trichology courses? We will teach you all that. Fourth is hair fall therapy. Now what is it containing about hair fall? How do we control the hair fall? So we teach you the laser scalp stimulation therapy, we will teach you the PRP therapy, microneedle therapy and mesotherapy. Also hair thinning problems. We will train you into hair thinning, how to treat hair thinning, we will train you into that. Hair volume enhancement. So many a times we need also camouflaging by hair integration for diffused hair loss or hair thinning, like say we also use this hair powders, like the hair powders are available in the market and Amazon and all that places. So we will teach you how to use that. Also hair follicle thickening, so we can teach you into how you can actually reverse the chemically damaged and the hairs and split ends, and anti-dandruff therapy. Third course, now this course is specially designed only for the doctors in the medical field to we will give you a training into 5 days FUE hair transplant certificate course, which is our mastery. We have already done with so many doctors have been trained by us, and also we have DNCC has achieved 1,20 lakh root transplant very successfully. So we are the master and training you to become masters. We will be, who all can do this? Now this is limited course for limited doctors, that is for BDS, MDS, MBBS, dermatologist or a plastic surgeon. Duration will be 5 days theory classes, and after 5 days we will give you certificate in FUE method of hair transplant. Also after completing this course, your existing skills will enhance and multifold your current income, or you can start your own hair transplant clinic. Observation will be 20 surgeries and we will give you hands-on for 30 surgeries. We also have the EMI facilities available for all our courses. So course details for this particular hair transplant which is there is like acquire fundamental knowledge about hair transplant. We will teach you about the scalp anatomy and physiology, which is, we as doctors you all know very little about it, and we will go through the detail about the anatomy, hair anatomy, and what are the stages of hair, what are the hair cycle and all that. So types, then second is types of alopecia. So there are multiple alopecia nowadays, alopecia areata, alopecia androgenetic, then alopecia, we have even traction alopecia, we have scarring alopecia, all that. So we will teach you all that. Then we will teach you how to take patient's medical history. So patient's medical history is very important, as we all know as a doctor where to stop. If the patient is having a diabetes and we are just doing blindly, it should not be done. We should do the medical history, we should do the evaluation of the patient, and we will also teach you how to do the pre-operative diagnosis. Then we have a FUE method of hair transplant. So why this only FUE? So this is the latest FUE method which we are going to teach you. FUT, we started, the hair transplant started with FUT method. But this FUT method is now become an old, and no one wants the scar on the scalp, and because of the big scar on the donor area, there is a delay healing, there is a cut, there is a scar, there is lots of problems. So nowadays no one wants that. So we will teach you how to do the FUE hair transplant. Now what are the equipment used for hair transplant surgery? We will give you a list of it, and we will show you one by one what all the equipments we are going to require for that. How many particular staff required for hair transplant surgery? So we will show you also that minimum this many staff we need in operation theatre to do the successful hair transplant. Then there will be initial consultation in pre-operative preparation. Now only this, we are not going to do only this, we will show you in initial consultation, but we will also give you all the forms required for the pre-operative and post-operative and intraoperative procedure. Now then we come to anesthesia and sedation. So what is the best anesthesia given, how it is given, what are the points to do the anesthesia, we will teach you all that. Then hair transplant stages like extraction, nicking, and then implanting. Post-transplant recovery, we will give you again one format where you can actually go through it and give your patients the advice how to take care of the transplanted root and the donor area. Then we will give you the follow-up sheets that how after the hair transplant, when they want to come in or when they have to come in for the dressing, they have to come in for the PRP treatments and all that. What is the outcome? So we will show you some case studies where we will show you that okay, this is poor outcome of the hair transplant surgery. Why it is poor also we will tell you, because then by the time you will also come to know that okay, this is not done properly and that is why the outcome is poor or good. Then we will also run through you complicated case studies. Hair transplant clinic setup also we will show you that okay, in operation theatre, what all things are required to set up this hair transplant clinic. So we will show you one by one what are the punches we use, what are the forceps we use, what is the monitor we use, what are the trolley used, what are the anesthesia used. So overall we will make you a very confident hair transplant surgeon. Then becomes the hair transplant market. So when you are dealing with hair transplant, you should know your market very well. Like how many patients are going through the hair transplant in India, how many patients are successfully treated by us or by anybody. And also we should know how much is the cost per graft people are charging and how we can start at minimum cost and maximum efficiency. Then we will have a question answer session, like you all can ask the question and we will answer. Learn hands-on to perform the latest state-of-the-art FUE method of hair transplant. Preparation for hair transplant, equipments, anesthesia, preparation of the mixture, infiltration technique, tumescent technique, maintenance of the anesthesia throughout the procedure. Site preparation, high density techniques, then follicular unit extraction, manual and motorized extraction, and robotic extraction also. Prevention of bleeding, technique to preserve donor hair follicles. So now when we remove the hair follicles, how do we preserve that hair follicle? So we will show you how to preserve body out time of the hair follicles should be minimum. So from extraction to implanting, how do we store those grafts is also very important. Then insertion of follicular units, how to handle complicated situation, post-operative care and follow-ups. This is the best opportunity for you and for us to grow together. Looking forward to work with you. Thank you.